This topic is failure to thrive or growth deficit. A child who is diagnosed with failure to thrive has significant growth and development that falls below what is expected of the same child at that same age. Their growth trend fails to consistently follow a progressive curve. You can see that here in the image. The child in the top growth chart is growing progressively. They follow the curve upward and remain within the 50th percentile. The child in the lower chart started growing appropriately and then slowly started to progressively decline in their growth. And they're passing over different percentiles of the growth curve, dipping down to below the 10th percentile. This is concerning and an example of failure to thrive. The child will present with poor weight and height development and other developmental delays. Diagnostic criteria includes their weight being less than 80% of what is expected of the same child at that age and sex, persistent decrease in growth over time, and their weight is less than the 2nd percentile. I want to highlight that we're going to start to do interventions when their weight falls below the 5th percentile. We don't want to wait until it gets all the way down to that 2nd percentile. Now, this doesn't only happen because the child isn't taking in enough calories. It can also happen due to underlying medical conditions and psychosocial factors. We need to fully understand the encompassing factors and conditions that the child is experiencing and being raised in. They may have inadequate caloric intake. We need calories to grow. Now, it could be simply because the child is not taking in enough calories, but this could be due to an underlying condition, a condition that causes difficulty with feeding, like a cleft lip or palate, food aversions, or a condition that causes difficulty with swallowing. It could be caused by inadequate caloric absorption. That could come from a cow's milk allergy or milk protein allergy. If you are seeing vomiting or increased vomiting with feedings, or excessive diarrhea or bloody diarrhea with feedings, you can tell that the body's not absorbing what it needs to from that milk. These next two conditions could cause problems with malabsorption. Cystic fibrosis. The body is not creating pancreatic enzymes, and therefore the nutrients are not being able to be absorbed. In celiac disease, it is an autoimmune condition in which gluten-containing substances cause the villi in the small intestines to collapse, and then they can't absorb those nutrients from the food. Or it could be caused by an increased metabolism, and that causes excess caloric expenditure. If that metabolism is revving really high, it's using a lot of calories to keep going. So even though the child is eating what seems like an adequate amount of food, they're burning those calories in a way that is not meeting their needs for growth. This can be due to a couple different congenital issues. Congenital heart defects. You'll notice that the child, while eating, will become exhausted. They might become diaphoretic and tachycardic and tachypnic. They'll become so fatigued that they can't continue eating. They're using all of those calories just to eat. And so then there's not enough calories for them to grow. Or it could be due to congenital HIV infection. Their body is using calories at a higher rate because they're constantly fighting that infection. And again, there's not enough calories left over for the child to properly grow. Then there are psychosocial factors. Poverty is the most common reason a child doesn't receive enough food or doesn't receive nutrient-rich food. Or there could be a lack of nutritional knowledge or appropriate feeding techniques. A child might be offered the wrong types of foods. They might be offered chips or high sugar content foods or high sugar content drinks. Or Things might be offered to an infant that they can't properly chew or swallow. Or there may be an impaired caregiver-child relationship, as seen in neglect or abuse. The caregiver may severely restrict food as a punishment for the child. Or there may be an unstable family environment. Maybe some trauma has happened. They've moved, or there's been a death in the family, or they have unstable housing. There may be maternal mental health issues or substance use disorder. A mother may have postpartum depression and not be able to care for her newborn. Or she may have substance use disorder and not be able to provide care for her child. Clinical features of failure to thrive. We expect to see poor weight gain. Remember, part of the diagnostic criteria is less than the second percentile in the growth charts. We'll also see prolonged, stunted growth over time. They may have a poor appetite, and this is because they're used to those convenient foods that lack nutrients. They lack vitamins, carbohydrates, and protein, and those are building blocks that children need to grow. They'll have fatigue and weakness because they're not taking in enough calories and proper nutrition. They may even become anemic because they're not taking in enough iron. Decreased muscle mass. That's because they're not taking in enough proteins and carbohydrates. So they'll lack muscle development, and they'll also have muscle weakness, which then goes into developmental delays. They're not strong enough to crawl or roll over or stand up or walk or skip and run, those things we see at different milestones. We'll also see behavioral issues. Now, some of these may also be due to other underlying conditions, or they may be due to neglect and abuse. They'll have irritability. They lack calories, nutrients, and glucose, and your body and your brain need that to grow effectively. They may be apathetic or withdrawn, and they may lack age-appropriate stranger fear. That means that they'll go up to any adult that comes in the room, even though they've never met that adult before. And they may avoid eye contact. Complications due to malnutrition. Short stature. They are not growing at the same rate we expect them to grow at for the same child at the same age. But with failure to thrive, it doesn't only affect the weight of a child and the height of a child. It can cause systemic effects. These effects can be seen on the brain and immune system. The lack of glucose, carbohydrates, and proteins will cause immune deficiencies and permanent damage to the central nervous system. The brain needs glucose to function, grow, and develop. If it doesn't get that glucose, it becomes impaired, and eventually permanent brain damage can happen. And long-term behavioral and emotional issues due to that permanent brain damage. The child will not be able to excel. They'll fall behind with their development and their communication skills. They will struggle with learning and also how to process emotions properly. Nursing interventions. Our number one goal is to make sure the children are growing appropriately. We do this by making sure they are taking in enough calories and supplementing any gaps in their nutrition. We can correct inadequate caloric intake to facilitate catch-up growth. We will encourage and find ways the child can grow at a faster rate than would be normal. We can do this with calorie-dense formula. Not necessarily more formula, just more calories within the formula. We want to initiate this gradually to avoid refeeding syndrome. Refeeding happens because the child's body is not used to needing to produce a lot of insulin because of the lack of caloric intake. We now start to give the body calories and nutrients, so the body overproduces insulin and shifts electrolytes, like potassium and phosphate, into the cells, and this leads to electrolyte imbalance, deficiency of these electrolytes. This may lead to life-threatening complications. That's why it's important we gradually increase caloric intake for these children. We want to monitor for formula intolerance, similar to a cow milk allergy. Is the child having increased vomiting or vomiting with each feeding? Excessive diarrhea or bloody diarrhea with feeding? This all shows the body cannot absorb the nutrients well and are just passing through the body. A different formula needs to be tested. We can give multivitamin supplements to make up for any gaps. And then carbohydrate additives. An example would be adding fortified cereals to formula, or for older children, offering it to them to eat. We'll be checking blood specimens for a comprehensive metabolic panel to detect fluid and electrolyte imbalances, which is important with refeeding syndrome, and with fluid imbalances due to incorrect water to formula ratios. We'll measure their height, weight, and head circumference at each visit. This helps us watch their trends in growth. We also want to observe the caregiver-child interaction, especially during feedings. Examples could include difficulty latching, or if the mother is experiencing postpartum depression and is not offering feeding appropriately, or is not able to care for the child. Noticing these early may allow you to detect abuse or neglect early. We also want to monitor for developmental delays, and if noted, implement therapies early on. The earlier the intervention, the better the outcome. We may also be able to provide social services referrals, maybe access to food if they have financial instability, or other community resources. If we notice or suspect any abuse or neglect, we are mandatory reporters, and we need to report to the appropriate authorities. We want to evaluate caregiver knowledge and teach age-appropriate nutritional intake. A great way to do this is have them keep a 24-hour log of their intake. This will allow us to see what is offered to the child, what the child is eating, and we can see if there's any areas that need extra education. We may need to give step-by-step instructions for formula preparation. This may help with difficulties with that water to formula preparation. You just need to follow the instructions. And providing a written schedule of feeding times. Normally it's about every 3 to 4 hours, depending upon the age of the child. You can even educate them about how much per feeding of formula a child should have, or how much formula over 24 hours they should have. We want them to use appropriate milk sources other than sugary juice drinks or other high sugar drinks. Now, if there is an allergy to cow's milk or milk protein, you can always have them offer something like almond milk or cashew milk. If there is no allergy, you want to offer dairy products 2 to 3 times a day. That can be in the form of milk, cheese, cottage cheese, or yogurt. We'll also want to do behavioral modification techniques. These will correct maladaptive feeding patterns. Many of these actions are learned, and if they're learned, they can be unlearned. An example might be if the child hears, oh, they don't like vegetables, or they won't ever try those vegetables. The child hears that and learns that, and then that's what they will start to do. These behaviors are learned, and we need to know about them so then we can teach them something else. And we want to take the family systems approach. Any change that the child is going to make, the whole family should make so that everyone is becoming healthier. This way the child will feel supported and also they'll be able to be successful.